Would I benefit from Botox and perhaps fillers for under eye area? When I smile, I have these ugly lines under my eyes. Also, when my face is resting, I'm starting to get fine lines. My goal would be to have them gone and not so dramatic when I do smile. I also plan on getting fillers in my cheeks. Do you think this would help with my eyes creasing as well? Thank you in advance.
Thank you for your question. You submitted a single photo, and your question covers a lot of areas, but it focused in the area around your eyes. You're describing lines that occur when you smile, the lines that are there when you're at rest. You're considering some injectables for your cheeks, and you want to know if that'll help your under eye area. And you started the question with about Botox. Well, this is certainly an area that we are very familiar with in our practice. Just to give you a little bit about my background, I'm a board-certified cosmetic surgeon. I'm a fellowship-trained oculofacial plastic surgeon. That means my background training was first in eye surgery before I did super specialty training in cosmetic and reconstructive surgery, the eyes and face. And so aesthetics of the eye is extremely important in our practice, and is something that we really we deal with a lot in our practice in Manhattan and Long Island for the past 20 plus years. So to begin with this discussion, it's important to first get some definitions. So with the definitions, you can then define the solutions. So when you describe the lines that form when you smile, what does that mean? It means that there's muscle activity that causes these lines to form. Now the term for that is called dynamic lines. Now you mentioned also lines that were there at rest. We refer to those as static lines. Now in addition, there are some other lines that you're describing when you smile and when the skin just kind of pushes upward. And those lines, I refer to them as the kind of like the accordion effect. So that when your face is animated, it's like an accordion. It's squeezing those lines and you're creating this rippling in the skin. So when I discuss options with my patients, I think of short-term solutions as well as long-term solutions. In the modern world where there are so many options and there are so many people offering the latest, greatest devices, I am seeing too often people who are bouncing from one doctor to another, from one medi-spa to another to try to catch up with what's going on with their changes. So let's start with first understanding the skin changes. Is this related to genetics or heredity? Is this related to environments such as sunlight and smoking? Is it related to also to just stress or hydration? Very often there are factors in the history that we can counsel our patients on to help improve the skin. Skin around the eyelids is like a 1/2 millimeter in thickness. It's very, very thin. It's practically transparent. So trying to build collagen around this area, trying to improve this appearance, has to be done in a very artful way. So in terms of dynamic lines, for dynamic lines, the gold standard is to use some kind of neurotoxin. This includes Botox, Dysport, Xeomin. Essentially, injectables which reduce muscle activity. Now that's fine for the crow's feet line area, but it is less optimal in the under eye area. And that's because the lines under the eyes are also related to the vertical lift of the cheek. So in our practice, what we try to do with these lines, which obviously really can't be filled, many have tried and most have failed because the fillers, such as in the hyaluronic acid family, just are too thick, and it makes this area look swollen. When we treat this global appearance, we look at the static lines from a different lens. And the static lines are lines that are basically a function of collagen loss. So how do we address collagen loss? where we try to stimulate new collagen. Now, the traditional methods have always been about different types of thermal energy devices. And I'm a big user of the fractional CO2 laser, as well as the occasional use of Peleve or radiofrequency. So it's not like I'm against thermal devices. But what I am against is the overuse of thermal devices. A lot of people come to me after they've gone to Clinic A, Clinic B, Clinic C, and have been heated up, heated up, heated up to the point where the skin has actually become thinner and more crepey. And then we're trying to figure out how to help them. Now, to help them, we've been very successful in using something called platelet-rich plasma, which is your own blood's plasma, which has the healing and growth factors needed for wound healing. And through strategic placement over time, we're able to build up the collagen in the skin. Now, I described this process similar to muscle building, like going to the gym. You work out and then you wait for the benefit of the muscle growth. The same thing applies with skin. You treat and then you step back and you allow it to respond. And we always have to customize based on the individual patient's response. Some people respond better than others. Now, we often combine this because there's often an overlap. If a person has wrinkles under the eyes and the crepey skin, then very often they either have puffy bags or they have under-eye hollows. So for under-eye hollows, we've also been very successful with using hyaluronic acid fillers. And in combination, hyaluronic acid fillers and platelet-rich plasma has actually been very effective, and it's something that our patients have appreciated and seen improvement. I always, and to address the issue or the discussion about the cheek volume, I think you're on the right track, but not in that it'll fill the under eye area, but what I always feel when I look at a face, because I'm a facial cosmetic surgeon, I do facelifts, I do cheek implants, I look at the eyes as they relate to the cheeks. So I very often will add volume in the malar, submalar area, the cheek area, the apples of the cheeks, so that it's not to exaggerate, but to rather restore volume, and the continuity of that area with the under eye area can be very, very nice when you combine modalities. If you think for a moment that there are people who are in their 20s, let's say they are surfers, and they're out in the sun all the time, and they're photo aging their skin. They're in their 20s, they're young, and yet even though they have a lot of wrinkles under their eyes, they look good. And the reason is because they have volume, and the volume is a key. But the volume is also, if done in a way that isn't beneficial, can also be a negative. So there's an art to doing all this. I think the key decision for you is to find the right doctor who you feel comfortable with, who will be your guide in this very tricky landscape, so that you can have a strategy and you can build on one on top of the other. In 20 years of practice, we have patients who have been with me, and we've all grown old together, and we've learned essentially how to customize for each individual patient. It's very, very important. Otherwise, people who jump around from place to place looking for the latest deal invariably waste a lot of money and don't get good results, and are constantly just getting frustrated. So I think that once you find the right doctor, these things will make sense. If there isn't a logic, and if there isn't good follow-up, then I don't see a reason why you should just try to work on finding these names and solutions, because you're not going to, the names like Botox, Juvederm, etc., these are tools for a skilled doctor and not solutions unto themselves. And that's why this is not a commodity. There is a real skill and a style, which is why there are different doctors who do it in different ways, and we can all use different fillers and get comparable results depending on the shared uh, concept that the patient and the doctor have about what a desired outcome will be. So I hope that was helpful. I wish you the best of luck, and thank you for your question.